we summarise the integration of cognitive behavioural therapy and EMDR in your treatment for emotional difficulties?
I will use this graph to illustrate how I work with it. So what we have is a trigger. We can have a trigger. And survival brain remembers the past and triggers the emotion. You are faced with an angry boss and you freeze as you used to do with your dad. So you will feel an emotion of fear. We will work with EMDR to resolve those past memories. Then we have a situation. Somebody asks you to do a presentation. Your brain somewhat appraises it as threatening. Negative automatic thoughts appear. They seem generally plausible. What if I panic? I'll appear stupid. I won't cope. With these thoughts, you trigger again the negative emotion of anxiety, and you have the physical symptoms with that. Those physical symptoms, we said, feel uncomfortable, or you may appraise them as harming to you. I can't breathe. In that way, you close the first loop. I can't breathe was an appraisal of threat that in turn will increase your anxiety and increase your physical symptoms. As a result, you may choose to avoid the presentation and you go into the behavior. By avoiding it, you actually provoke another negative thought. I'm not good enough, with more negative emotion and more physiological symptoms. You can continue to ruminate or worry about how other people may perceive you. And that is a loop number 3, which in turn will create more negative thoughts. I am a failure, more negative emotions and more negative physical symptoms and behaviors. You cannot stop the trigger, situation, negative automatic thoughts, or emotion and physical symptoms. So these will happen anyway, but we can draw a line. You can act on the other elements of this graph. You can turn back to physical symptoms and emotion, and you can calm your survival brain down by deep breathing, by imagination, by relaxation, or by mindfulness. Once you calm, you may go back to reevaluate your negative thoughts and make them more accurate. In that way, you learn to stop misinterpreting the physical symptoms as dangerous to you. You stop avoiding, because avoidance reinforces anxiety. You learn to stop ruminating about the past or worry about the future. In that way, your human brain helps your survival brain and they work in harmony.